drug interactions, and their effects on treatment efficacy. Have you ever wondered why your doctor warns you not to take certain medications together? Or why the pharmacist asks what other drugs you're taking before dispensing your prescription? Today, we're diving deep into the world of drug interactions, what they are, how they affect your treatment, and what you need to know to stay safe. What are drug interactions? Drug interactions occur when a substance affects how another substance works in your body. These interactions can change how effective your medication is, increase side effects, or even create new and dangerous reactions. Understanding these interactions is crucial for everyone who takes medication. Drug interactions come in several forms. Drug-drug interactions. When two or more medications interact with each other. Drug-food interactions, when medications interact with certain foods or beverages. Drug supplement interactions, when medications interact with vitamins, minerals, or herbal supplements. Let's explore each type and understand how they impact your health. How drug interactions affect treatment efficacy. Drug interactions can impact your treatment in three main ways. First, they can decrease medication effectiveness. Some interactions reduce how well your medicine works by preventing proper absorption, speeding up elimination from your body, or blocking its action at target sites. For example, certain antacids can prevent antibiotics from being absorbed properly, making them less effective at fighting infection. Second, interactions can increase the risk of side effects or toxicity. When one drug slows the breakdown of another, medication levels can build up in your bloodstream to dangerous levels. This is particularly concerning with medications that have a narrow therapeutic window, where the effective dose is close to the toxic dose. Third, interactions can affect how drugs are processed in your body. Your liver contains enzymes that break down medications. Some drugs can either inhibit or induce these enzymes, significantly altering how other medications are metabolized. Common types of drug interactions that reduce drug effectiveness. When certain drugs are taken together, one may reduce the effectiveness of the other. For example, rifampin, used to treat tuberculosis, can decrease the effectiveness of oral contraceptives, potentially leading to unintended pregnancy. Dose calcium supplements can bind to certain antibiotics like tetracycline and ciprofloxacin, preventing their absorption. Antacids can reduce the absorption of many medications by changing stomach acidity. These interactions don't just make your medication less effective, they can completely undermine your treatment plan. Interactions that increase side effects or toxicity. Some drug combinations can amplify side effects or even create toxic reactions. Taking NSAIDs like ibuprofen with blood thinners like warfarin increases bleeding risk. Combining certain antidepressants with pain medications can lead to serotonin syndrome, a potentially life-threatening condition. Using multiple medications that affect the heart's electrical system can increase the risk of dangerous rhythm disturbances. These interactions don't just cause discomfort. They can be life-threatening in some cases. Interactions that affect drug absorption or metabolism. Many interactions occur because drugs compete for the same pathways in the body. Grapefruit juice inhibits enzymes responsible for breaking down many medications, leading to higher blood levels and potential toxicity. Some anti-seizure medications can speed up the metabolism of other drugs, reducing their effectiveness. Certain antifungal medications can block the breakdown of cholesterol-lowering statins, increasing the risk of muscle damage. Understanding how your medications are processed can help you avoid these interactions. Well-known drug interaction examples: antibiotics and dairy products. Have you ever been told to avoid milk when taking antibiotics? There's good reason for this precaution. Tetracycline antibiotics bind to calcium in dairy products, forming compounds that can't be absorbed by your body. This means the antibiotic won't reach effective levels in your bloodstream. Your infection may not respond to treatment. You might need additional or stronger antibiotics later. To avoid this interaction, take these antibiotics at least 2 hours before or after consuming dairy products, warfarin and vitamin K-rich foods. Warfarin is a blood thinner that works by blocking vitamin K's role in blood clotting. Foods high in vitamin K, like leafy greens, can interfere with warfarin's effectiveness. Suddenly increasing your consumption of spinach, kale, or other leafy greens can make warfarin less effective. This increases your risk of blood clots and potentially stroke. Conversely, decreasing your vitamin K intake could make warfarin too effective, increasing bleeding risk. The key isn't to avoid these healthy foods entirely, but to maintain consistent vitamin K intake and monitor your blood clotting regularly. Heart medications and mineral supplements, calcium channel blockers, beta blockers, and other heart medications can interact with mineral supplements. Calcium supplements may reduce the absorption of certain heart medications. Magnesium supplements may enhance the blood pressure lowering effects of some medications, causing dangerous drops in blood pressure. Potassium supplements combined with certain blood pressure medications can lead to dangerously high potassium levels. Always separate heart medications and mineral supplements by at least 2 to 4 hours and consult your healthcare provider before starting any supplement. Herbal supplement interactions, St. John's wort and antidepressants. St. John's wort is a popular herbal remedy for mild depression, but it can dangerously interact with selective serotonin reuptake inhibitors, SSRIs, monoamine oxidase inhibitors, MAOIs, many other prescription medications. The interaction can cause serotonin syndrome, characterized by high fever, seizures, irregular heartbeat, and in severe cases, death. St. John's wort also reduces the effectiveness of many medications including birth control pills, transplant anti-rejection drugs, and HIV medications, ginkgo biloba and blood thinners. Ginkgo biloba is often taken for memory enhancement, but it has natural blood-thinning properties that can interact with warfarin, aspirin, clopidogrel. These combinations significantly increase the risk of internal or external bleeding. Always disclose all supplements to your healthcare provider, especially if you're on blood thinners. The importance of consulting healthcare professionals. Before making any changes to your medication regimen, always consult your doctor or pharmacist. Starting a new medication, whether prescription or over-the-counter, using supplements, including vitamins, minerals, or herbs. Changing dosages. Any adjustment can alter the risk of interactions. Experiencing unusual symptoms. These might indicate an interaction. Healthcare professionals have access to comprehensive databases that can identify potential drug interactions and suggest alternatives or adjustments to prevent problems. Practical tips to avoid drug interactions. Use a medication card or digital record. Keep an updated list of all medications, supplements, and herbal products you take. Include medication names, both brand and generic, dosages, frequency, reason for taking, start date. Share this list with all healthcare providers, even specialists who might not have your complete medical records. Regular medication reviews. Schedule regular medication reviews with your doctor or pharmacist, at least once yearly for those taking multiple medications. After starting any new medication. When experiencing unexpected symptoms. Before undergoing any medical procedure. During these reviews, discuss all prescription drugs, over-the-counter medications, and supplements you're taking. Use one pharmacy. Using a single pharmacy for all your prescriptions creates an additional safety net. Pharmacists can track all your medications. Automated systems can flag potential interactions. Your medication history is in one place. If you must use multiple pharmacies, make sure each has your complete medication list. Read medication information carefully. Every prescription comes with detailed information about potential interactions, foods to avoid, warning signs of adverse reactions, special instructions for taking the medication. Don't discard this information without reading it thoroughly. Never stop medication abruptly without medical supervision, even if you suspect a drug interaction. Contact your healthcare provider first. Don't adjust dosages on your own. Continue taking prescribed medications until advised otherwise. Report any new or worsening symptoms immediately. Stopping certain medications suddenly can cause serious withdrawal effects or worsening of your condition. Prevention through knowledge. Understanding drug interactions is essential for your health and safety. Remember, no question is too small when it comes to your medications. Disclose everything you take to your healthcare providers. Be especially cautious if you take multiple medications. Always check before adding new supplements or over-the-counter drugs. With proper knowledge and communication with your healthcare team, you can minimize the risks of drug interactions while maximizing the benefits of your medications. By staying informed and proactive about potential drug interactions, you're taking an important step towards safer, more effective treatment. Your health is worth the extra attention, and understanding these interactions empowers you to be an active participant in your healthcare decisions. Remember, prevention begins with knowledge and continues with open communication with your healthcare team. Stay informed, stay safe, and stay healthy.